Namaste. Today topic is emergency drugs. Also we can call it as life-saving drugs. Introduction. Emergency drugs are chemical compounds used in patient during life-threatening conditions so that the symptoms can be controlled and the life of the patient can be saved. So those emergency drugs are being used during a emergency situation or in a critical condition. So it is a life saving drugs. By using this kind of a drugs we can save the patient lives. So today I am going to explain you in detail of what are all the list of emergency drugs and its action and what is the side effect of a medications. So the list of emergency drugs are injection atropine, injection adrenaline, avil, adenosine, amiodarone, xylocard, soda bicarb, calcium gluconate, Lasix, magnesium sulfate, lorazepam, dopamine, dobutamine, hydrocortisone, heparin, dextrose 25% or 50%, naloxone, glucagon, potassium chloride and 3% NS. So these are all the list of emergency drugs. So always we should make sure these drugs are available in the department so that it can be used during emergency situation and we can save the patient life. Injection atropine. Atropine belongs to class of drug called anticholinergic or antispasmodic agent. It is used in emergency situation when the heart beats slow. It is used to treat bradycardia, slow heart rate. It helps to restore normal heartbeat in cardiac arrest cases. As an antidote to, for example, organophosphate, insecticide or nerve gas poisoning, and in mushroom poisoning, it can be used as a part of the pre-medication before general anesthesia. Atropine may cause serious side effects includes fast heart rate, high pressure in the eye, glaucoma, abdominal blockages, pyloric obstruction, worsening urinary retention and mucus in your airway. So these are all the atropine side effects, and common side effects are dry mouth, blurred vision, sensitivity to light, lack of sweating, dizziness, nausea, loss of balance, hypersensitivity reaction, skin rashes and rapid heart rate. These are all the common side effects. Next is adrenaline. Adrenaline is sympathomimetic agent. Adrenaline or epinephrine injection is used in a treatment of life-threatening emergencies like severe allergic reaction and cardiac arrest. It rapidly relieves breathlessness and wheezing by relaxing the airways. It also stimulates the heart and increases the blood pressure. Side effects are headache, palpitation, tremors. Next is avil. Avil injection is an anti-allergic medication. It is used to treat symptoms of allergic condition caused by insect bite, stings, certain medications. Avil 25 mg injection is an antihistamine with a little sedative action. It is used to prevent or treat allergic reactions. Avil injections phenyramine primarily used to treat allergic condition. It helps treat allergy like running nose, sneezing, congestion, itching and watery eyes. It is also used relieve motion sickness, nasal congestion and all allergic irritations. Common side effects are sleepiness, dryness in a mouth. Next is adenosine. Adenosine belongs to a class of drug called antidysarrhythmic. Intravenous adenosine is a safe and efficacious treatment for the emergent treatment of supraventricular tachycardia. So this adenosine is a antiarrhythmic drug. It will be used for to prevent or control the SVT. The most common side effects are flushing, sudden warmth, redness or tingly feeling, chest pressure, shortness of breath, nausea, headache, dizziness and discomfort in your neck or jaw. So these are all the common side effects. Next one, amiodarone, or we can call it as cordarone. It is also antiarrhythmic drug. Amiodarone is used to help keep the heart beating normally in people with life-threatening heart rhythm disorder of the ventricles. Amiodarone is used to treat or prevent ventricular tachycardia or ventricular fibrillation. So this amiodarone also antiarrhythmic drug. It will be used to treat VT and VF. Common side effects are nausea, vomiting, constipation, loss of appetite, shaking or tiredness may occur. Serious side effects are this medication has the risk of serious side effects. These include serious lung problems, liver problem and a worsening of your irregular heart rate. These problems can be fatal. Next is calcium gluconate. Calcium gluconate is most commonly used in emergency situation to treat several conditions. It is used to manage hypocalcemia, cardiac arrest and cardiotoxicity due to hyperkalemia or hypermagnesemia. It is classified as a calcium salt. Side effects are nausea, vomiting, decreased appetite, constipation, dry mouth, increased thirst, increased urination, tingling sensation. So this calcium gluconate also very important emergency drug. It should be available in a crash card. Next is dopamine. Dopamine is a inotropic drug. Dopamine is used to treat the symptoms of low blood pressure, low cardiac output and to improve blood flow to the kidneys. Dopamine may be used alone or with other medication. What are all the side effects from the dopamine is irregular heartbeats, nausea, vomiting, anxiety, headache, chills, goosebumps, shortness of breath. Next one is hydrocortisone. Hydrocortisone are glucocorticoids or steroids. Hydrocortisone is used to treat certain medical conditions such as inflammation like swelling, severe allergic reactions, kidney diseases, adrenaline problems, arthritis, asthma, blood or bone marrow problems, eye or vision problem, lupus, skin conditions and ulcerative colitis. What are all the side effects from the hydrocortisone is headache, dizziness, slowed healing of cuts and bruises, again thin, fragile or dry skin, red or purple blotches or lines under the skin, skin depressions at the injection site. So these are all the side effects of a hydrocortisone. Next is soda bicarbonate. Sodium bicarbonate is a compound used for the symptomatic treatment of heartburn, acid indigestion and upset stomach as well as the treatment of metabolic acidosis associated with conditions such as severe renal diseases and circulatory insufficiency due to shock. The most common side effects are fever, infection at the site of injection, blood clot in the veins, phlebitis, fluid leakage from the injection site and fluid overload. Next is Zylocard. Zylocard is an antiarrhythmic drug. It is used to change an abnormal beat in the heart back to normal. It works by slowing nerve impulses and reducing the excitability of the heart. Xylocard belongs to a group of medicine known as antiarrhythmic. Side effects are drowsiness, lightheadedness, nervousness, dizziness, blurred vision, vomiting, twitching, tremors, feeling hot or cold or numb, difficulty swallowing, slurred speech. Next is naloxone. Naloxone is the life-saving antidote for opioid overdose. Naloxone injection is used for emergency treatment of an opioid overdose or a possible overdose. It will temporarily reverse the effect of an opioid medicine. Common side effects are agitation, body ache, chest pain, coughing that sometimes produces a pink frothy sputum, crying more than the usual in a baby's diarrhea. Next is Lasix. Lasix injection belongs to a group of medicines called diuretics. It is used for the emergency treatment of very high blood pressure, hypertensive emergency. As it reduces the blood pressure immediately, it also rapidly reduces the swelling like edema caused by too much water in the body. Side effects are increased urination, thirst, muscle cramps, itching or rash, weakness, dizziness, spinning sensation and diarrhea. So, Lasix is a diuretic drug. Next is magnesium sulfate. Magnesium sulfate injection is used to treat hypomagnesemia, low level of magnesium in your blood. Magnesium sulfate injection is also used to prevent seizures in pregnant women with conditions such as pre-eclampsia, eclampsia or toxemia of pregnancy. Side effects are heart disturbances, breathing difficulties, poor reflexes, confusion, weakness, flushing, sweating, lower blood pressure. Next is potassium chloride. KCl injection is a medicine used in the treatment of potassium deficiency in the body. These supplements can relieve muscle weakness, irregular heartbeat, nausea and vomiting. It is an essential nutrient of our body which helps in the maintenance of good health. What are all the side effects of KCl? Severe throat irritation, chest pain, trouble breathing, pain, burning, bruising, swelling, irritation or skin changes where the medicine was injected, stomach bloating, severe vomiting, severe stomach pain. Next is heparin. Heparin, it is also known as anticoagulant. This medicine is used to prevent and treat blood clot. It may be used to prevent and treat blood clot in the lungs, legs, including the patient with atrial fibrillation. It may be used to treat certain blood clotting disorders. It may also be used to prevent blood clot after surgery, during dialysis, during blood transfusions, when collecting blood sample or when a person is unable to move for a long time. Heparin helps to keep blood flowing smoothly by making a certain natural substances in your body, anti-clotting protein, work better. Side effects are abdominal or stomach pain or swelling, back pain or backache, bleeding from the gums when brushing teeth, blood in the urine, coughing up blood, headache, severe or continuing, heavy bleeding or oozing from cut or wound. Next is Dobutamine. Dobutamine is inotropic drug. Dobutamine stimulates heart muscles and improve blood flow by helping the heart pump better. Dobutamine is used short term to treat cardiac, decompensation due to weakened heart muscles. It supports in low cardiac output, hypoperfusion states, cardiomyopathies, and in cardiogenic or septic shock. Major and minor side effects are increased heart rate, chest pain, changes in blood pressure, irregular heartbeat, headache, shortness of breath, increased urination, nausea. So, dobutamine is also one of the inotropic drug. It is also emergency drugs. Next is lorazepam. Lorazepam injection is used before certain medical procedures including surgery to relieve anxiety. When lorazepam is used before surgery, the patient will not remember some of the detail about the procedure. It is also used to treat seizure including status epilepticus. Common side effects are drowsiness, dizziness, tiredness, weakness, dry mouth, diarrhea, nausea, changes in appetite. Next is 3% saline. 3% sodium chloride is a hyperosmolar agent that can be life-saving for patients with severe hyponatremic encephalopathy, traumatic brain injury, and cerebral edema. Common side effects are fever, infection at injection site, redness, red streaking, and swelling from the site of injection. Next is 25% or 50% dextrose. Dextrose is antidote is used for acute alcohol intoxication, sulfonylurea overdose, insulin overdose, high blood potassium in the sense hyperkalemia, and insulin induced hypoglycemia. So it is an antidote for this kind of a situation. Side effects are redness, swelling, warmth or skin, confusion, a light-headed feeling like you might pass out, fever, swelling in your hands or feet, sweating, pale skin, severe shortness of breath, chest pain. Next is glucagon. Glucagon injection is an emergency medication used to treat severe hypoglycemia, low blood sugar, in diabetic patients treated with insulin who have passed out or cannot take some form of sugar by mouth. Glucagon injection is also used as a diagnostic aid during X-ray test of the stomach and bowels. Side effects are nausea, vomiting, heavy injection site swelling or redness, headache, fast heartbeat. Now we came to know what are all the list of emergency drugs and its action and side effects.